Men on TRT, stop blocking your estrogen. We have a lot of patients that come to our clinic. They're either from other clinics or just getting started, and they're worried about their estrogen being too high. Now let's backtrack. In the body, there are multiple hormones that we manage and optimize when you come to a clinic like ours. Estrogen is one of them. So there's a constant and ongoing debate as to whether a person needs to block or lower their estrogen. There's a big misconception that estrogen is the root of all evil for men when they're on hormone replacement therapy. People that come to us from other clinics that are not being managed appropriately are automatically given things like prescription estrogen blockers or things like DIM, which is a more natural substance and over-the-counter remedy that people use to block the conversion. What people don't understand is that too much or too little of anything is not ideal or optimal. However, blocking the conversion of testosterone to estrogen with an aromatase inhibitor is not the way. So aromatase is an enzyme that converts your testosterone to estrogen. What people or clinicians don't understand, I should say, is that when you block this cascade with anastrozole, what you are essentially doing is ruining a lot of the benefits that you get from being on hormone replacement therapy. Because estrogen is something that's important for not only women, but men as well. As far as libido, it is cardioprotective, helps protect your brain, so for cognitive function, as well as many other things. So, before we even consider blocking your estrogen with a toxic drug, we must first understand a few things. First off, in men, there is clear evidence that estrogen acts more as a paracrine hormone, meaning that its effects are in the tissue, not the blood. So, most blood work is not actually reflective of what's going on in your tissues. Lab values are merely a spillover effect in the serum. If you are going to get labs at all, as far as an estrogen, you should never get a plain estrogen level on a patient. This is because your body has many different forms of estrogen that get picked up with a regular estrogen level. This often makes the levels falsely elevated, and as a result, clinicians panic, and instead of knowing how to actually manage a person's symptoms and what's causing the symptoms, they look at a number and start patients on unnecessary medications and often cause patients to be worried about something they don't need to be worried about. So, when assessing the patient's lab work, if you're going to check an estrogen level, you need to check an ultra-sensitive estradiol using liquid chromatography at a lab. This will help filter out all the other types of estrogen from the estrogen that a clinician should be monitoring if you're going to monitor the patient's estrogen at all. If you are going to a clinic and they automatically start you on an aromatase inhibitor, whether you first start out hormones or if your estrogen looks elevated without first discussing interventions that you can do, you need to just simply go to a new clinic. First off, one of the many things that could be falsely raising your levels on your lab work is your diet. So if you're eating a high processed food diet, as well as excessive carbohydrates, this will cause your levels to be falsely elevated on lab work. In addition, other things like stress and chemicals that we put in our body, whether it's in our food, cosmetic products, they can cause a lot of alterations on lab work. There's also a misconception that high levels of estrogen, whether from TRT or in general, cause gynecomastia. This is an elevation or a rise or enlargement of fat tissue. Men, especially when they first start hormones, they're worried about this happening. What people don't understand is that true gynecomastia is caused mostly when people are going through puberty. There is a genetic predisposition to develop gynecomastia. So the fear of estrogen being elevated is way overblown, and as a result, people are being managed inappropriately and started on drugs that affect their metabolic health for the long term. For more personalized advice, please feel free to reach out to our clinic. Our goal is to help you look better, feel better, and perform better in all aspects of your life. Get started today.